Hello friends, nowadays our improper dietary habits and unmanageable lifestyle is creating loads of diseases in our body. One such lifestyle disorder I am discussing here today is PCOD. PCOD, that is polycystic ovarian disease, यानी कि ovaries में गांठों का बढ़ जाना. A person, a woman who is affected with PCOD generally have very irregular periods and an evolution during the cycle, that is उसके periods के दौरान egg का ना बन पाना और difficult to attain pregnancy are the most common features of a person affected from PCOD. Today in this video I am discussing about the possible causes of PCOD, its possible symptoms and Ayurvedic remedies and treatment for PCOD. So stay with us for the whole video and watch till the end to get the sure knowledge about PCOD and its treatment. Next, the symptoms of PCOD. The first and foremost presentation of the patients with PCOD is the irregular periods. The patients suffering from PCOD usually have 7 to 8 periods in a year. The patient may complain of heavy bleeding during the periods. Second commonest presentation is abnormal weight gain. The weight gain usually is in the form of central obesity, that is the obesity around the hip area or the waist area. Third commonest presentation is excessive unwanted hair around the face, neck, chest, back and the thighs. Patient may also complain of hoarseness of voice or very harsh voice. The skin of the patient becomes very oily and she can have acne or pimples over the face. Male pattern baldness is seen especially on the scalp and around the temple area. And the last presentation or last feature is difficulty in attaining pregnancy over long periods of time after marriage. So what are the possible diagnostic tests which are to be done in a patient of PCOD? The first commonest test which is done is ultrasonography, which shows the formation of cysts specifically in a circular fashion. Next is a hormonal profile in the form of luteinizing hormone, prolactin hormone, testosterone levels and estrogen levels. Sex hormone binding globulin, which is decreased in a patient of PCOD. GTT, that is glucose tolerance test in the patient with insulin resistance. Thyroid profile, lipid profile are also advised along with. PCOD is a very common health problem which can occur in women from the age of 15 years till 45 years. In PCOD, the function of ovaries is disturbed and ovaries are not able to produce the eggs and thus in turn there is difficulty in attaining the pregnancy. The first and foremost cause is hormonal imbalance. In PCOD patients, there is increase in production of male sex hormone, that is testosterone, alongside other hormones like prolactin and luteinizing hormones. They are also increased. There is reduced production of SHBG, sex hormone binding globulin, which in turn hampers the ovaries and the cessation of egg formation is there. Thus, in turn, patients become amenorrheic and they are not able to have their periods regularly and pregnancy is disturbed. Second most common cause is genetic. A woman who is having PCOD has double the chance of transferring the disease to her daughter. Third common cause is insulin resistance. Insulin is a hormone in our body which helps in the digestion of glucose. In PCOD, the formation of insulin is disturbed and low quality of insulin is produced in the body. So there is increase in level of insulin in the body, which in turn results in excessive weight gain. Low active bodies or lack of activities can also result in PCOD, and no exercises and excessive pollution in the form of environmental pollution or toxins in the food, they also result in PCOD formation. So what should be done when a patient of PCOD comes to our clinic? There are 3 steps to be kept in mind during the treatment. These are to stimulate the ovaries, to regularize the periods and to balance the hormones. In Ayurveda, we follow a 4-step regime in the treatment of PCOD. These are, the first is diet. Second is lifestyle modifications. Third, oral medications. And fourth, Panchakarma therapies. A patient suffering from PCOD should follow a very healthy and balanced diet. Her diet should be a good protein-based diet with the help of beans, chickpeas, black grams, green leafy vegetables should be there in the diet, rice bran oil or coconut oil, very good. Alongside, she can also take nuts like walnuts, groundnuts, chia seeds, flax seeds, या अलसी के बीज. But she should avoid the intake of excessive cold drinks, ice creams, fried and spicy foods, corn flours, Chinese items like pizza, burger, noodles, excessive use of mayonnaise, breads, bakery items, excessive potatoes, rice. These should be avoided in the diet. A patient with PCOD should improve her lifestyle. She should avoid watching TV for the long hours or listening to music for late nights. Excessive use of mobiles or laptops should be avoided. She should encourage herself for losing weight because losing weight will improve the quality of insulin and helps in formation of eggs and in turn helps in attaining the pregnancy. She should encourage herself for exercises, yoga, pranayama, at least for 30 to 40 minutes in a day. She should have a sound sleep, maximum of 7 to 8 hours in a day. She should be happy, she should remove and catheterize all the stress in her brain. In the treatment of PCOD, Ayurveda is extremely beneficial and we in our hospital use a variety of herbal formulations in the form of certain herbs. The most common herbs which are used are, first is Shatavari. Shatavari regularizes the periods, balances the hormones, reduces the hair fall and promotes fertility. Second one is Ashoka. It's a very good drug for the woman and a must have in the house. It stops the heavy bleeding during the periods, promotes fertility and regularizes the hormones. Third one is Lothra or Simplicus racemosa. Similar to Ashoka, Lothra is also useful in heavy periods and extreme pains during the periods. Fourth one is our very own aloe vera or Gritkumari. In the women who are suffering from lack of periods or scanty periods during menstruation, aloe vera is very useful. It is also useful in people who are having acne or pimples on their face. Fifth one is Brahmi or Bacopa manari. In PCOD, women are having mental disturbances, depression, irritation, loose temper. Brahmi helps in restoring the brain nerves and nourishes them and produces a sense of calmness in the head. Other drugs which are useful are soa or fennel seeds are extremely beneficial in the treatment of PCOD. The fourth most important step in the treatment of PCOD by Ayurveda is Panchakarma treatment. In our Ayurveda hospital, we use a variety of Panchakarma procedures for PCOD. What happens in PCOD? There is obstruction of channels and with the help of Panchakarma procedures, we rechannelize the body and also help to remove the toxins present in the body. The Panchakarma procedures which we use are Vaman, that is the emesis therapy, and vomiting. Second one is Virechan or purgation therapy. Third one is Enema or Basti, in which the medicated enemas with oils or decoctions are given. Fourth one is a Nasya therapy, in which the medicated oils or ghee is instilled in the nose. Also, the use of Uttar Basti is recommended in a patient of PCOD. In PCOD, the medicated oils are directly inserted into a vaginal loop of a woman, which helps in stimulating the ovaries and removes the toxins present in the vaginal pathways, thus helps in attaining the pregnancy. So friends, here I have discussed about the possible causes, symptoms, its investigations and the Ayurveda treatment protocols which are advised in the treatment of PCOD. Hope you have liked my videos and my view about PCOD. To get these kind of videos and more updates regarding Ayurveda and lifestyle management, please follow our YouTube channel Dr. Amit Mahajan Ayurveda, my Facebook page Dr. Amit Mahajan Ayurveda, and please subscribe our channel.